Understanding vaginal health anatomy and the microbiome. The vagina, a crucial part of the female reproductive system, plays a vital role in sexual health and overall well-being. It's a muscular canal extending from the vulva to the cervix, lined with a mucous membrane for lubrication and protection. The vaginal microbiome, dominated by Lactobacilli, maintains vaginal health by producing lactic acid, keeping the pH acidic. This acidic environment inhibits harmful bacteria and yeast growth. Maintaining this balance is essential for preventing infections. Factors like hormonal changes, hygiene, and sexual activity can influence the vaginal microbiome. Common culprits. Exploring vaginal infections. Vaginal health is a crucial aspect of overall well-being, and understanding the common infections that can occur is essential. Vaginal infections often result from an overgrowth of bacteria or yeast. These microorganisms are naturally present in the vagina but can multiply excessively under certain conditions. Bacterial vaginosis, BV, is the most common, caused by an imbalance of vaginal bacteria. This imbalance can lead to symptoms like unusual discharge, odor, and discomfort. BV is linked to multiple sexual partners, douching, and other factors. These activities can disrupt the natural balance of bacteria in the vagina. Yeast infections or vaginal candidiasis are due to an overgrowth of Candida albicans. Symptoms often include itching, redness, and a thick white discharge. Factors like antibiotics, hormonal changes, and weakened immunity can trigger yeast overgrowth. It's important to be aware of these triggers to manage and prevent infections. Trichomoniasis, a sexually transmitted infection, is caused by the parasite Trichomonas vaginalis. This infection can lead to symptoms such as itching, burning, and unusual discharge. It spreads through sexual contact and causes inflammation and discharge. Prompt treatment is necessary to prevent complications and transmission to partners. Urinary tract infections, UTIs, affect the urinary system but can occur with vaginal infections. Symptoms may include a burning sensation during urination and frequent urges to urinate. UTIs are usually caused by bacteria entering the urethra and traveling to the bladder. Maintaining good hygiene can help prevent these infections. Recognizing these infections and their causes is crucial for effective treatment. Early detection and proper care can prevent complications and improve health outcomes. Seek medical advice for proper diagnosis and treatment. Consulting with a healthcare provider ensures you receive the appropriate care and guidance for managing vaginal infections. Recognizing the signs, symptoms, and when to seek help. Vaginal infections often present noticeable symptoms, signaling an imbalance in the body's natural flora. Abnormal vaginal discharge is a common symptom, varying in color, consistency, and odor, which can be alarming. BV, or bacterial vaginosis, causes a thin, grayish-white discharge with a distinct fishy odor, while yeast infections result in thick, white, cottage cheese-like discharge that can be quite uncomfortable. Vaginal itching and irritation, ranging from mild to severe, are other signs that should not be ignored. Pain during urination or sexual intercourse is a red flag that something may be wrong. Infections can irritate the urethra and vaginal tissues, causing significant discomfort and pain. Vaginal bleeding or spotting between periods may also occur, indicating a potential issue. Self-treating infections is not recommended, as it can lead to complications. Consult a healthcare provider for an accurate diagnosis and appropriate treatment plan. Prompt medical attention can prevent complications and ensure a quicker recovery. Stay vigilant and seek help when needed to maintain your health and well-being. Diagnosis decoded. Identifying vaginal infections. Diagnosing vaginal infections involves medical history review, physical examination, and lab tests. Your doctor will ask about previous infections, STIs, and health conditions. A pelvic exam assesses the health of your vagina and cervix. A speculum is used to examine the vaginal canal and cervix for abnormalities. A sample of vaginal discharge may be collected for lab analysis. A vaginal pH test may also be performed. Once diagnosed, your healthcare provider will discuss appropriate treatment options. Treatment tactics addressing vaginal infections. Treating vaginal infections promptly is crucial for relief and prevention. Early diagnosis and treatment can prevent complications and ensure faster recovery. Bacterial vaginosis, commonly known as BV, is treated with antibiotics. These antibiotics are available in oral form or as a vaginal cream or gel, depending on the severity and type of infection. It is essential to complete the full course of antibiotics as prescribed by your healthcare provider to ensure the infection is fully eradicated. Yeast infections, another common type of vaginal infection, are treated with antifungal medications. These can be in the form of oral tablets, creams, or suppositories. Over-the-counter treatments are available for mild yeast infections, but it is always best to consult with a healthcare provider for proper diagnosis and treatment. Trichomoniasis, a sexually transmitted infection, is treated with antibiotics. It is important that both partners receive treatment to prevent reinfection. Abstain from sexual activity until treatment is complete to avoid spreading the infection. Urinary tract infections, or UTIs, are also treated with antibiotics to prevent the infection from spreading to the kidneys or other parts of the body. Drinking plenty of fluids helps flush out bacteria from the urinary tract, aiding in faster recovery. Always follow your healthcare provider's advice for effective treatment and to avoid any potential complications. Proper treatment ensures a swift recovery and prevents complications, allowing you to return to your normal activities with peace of mind. Prevention power: maintaining vaginal health. Preventing vaginal infections is key to overall well-being. Good hygiene practices like wiping front to back are essential. Wear breathable cotton underwear and avoid tight clothing. Avoid douching, as it disrupts the vaginal microbiome. Use gentle, fragrance-free soaps and feminine hygiene products. Practice safe sex to prevent STIs. These habits promote a healthy vaginal environment. Vaginal health through life stages. Adolescence to menopause. Vaginal health evolves through different life stages. During adolescence, hormonal changes impact vaginal health. The reproductive years bring hormonal fluctuations affecting the vaginal microbiome. Menopause leads to hormonal shifts, thinning vaginal tissues, and changes in pH balance. Good hygiene, safe sex, and prompt medical attention are essential. Understanding these changes helps maintain optimal vaginal health. Expert insights. Words from healthcare professionals. The vagina is a powerful organ deserving of care. Dr. Jennifer Gunter, OB/GYN and author of The Vagina Bible. Maintaining a healthy vaginal microbiome is like tending to a delicate garden. Dr. Alyssa Dweck, OB/GYN and co-author of V is for Vagina. Vaginal infections are common, seek help without shame. Dr. Lauren Streicher, OB/GYN and author of The Essential Guide to Hysterectomy. Healthcare providers are there to support and provide the best care. Stay informed and proactive for optimal vaginal health. Conclusion: prioritizing your vaginal well-being. Vaginal health is integral to overall well-being. Understanding anatomy, the microbiome, and common infections empowers women. Good hygiene, awareness of symptoms, and prompt medical attention are key. Stay informed and proactive for lifelong vaginal comfort and well-being.